One more time, welcome to the Genius class. I'm going to share the screen. Okay, so welcome to the Genius class 2023. We're going to look at the scenario of separation anxiety. Candidate instructions. In this particular case, we're an FY2 in a GP surgery. An 8-month-old boy, okay, has got irritability or is irritable. Father has made an appointment, telephone appointment, to talk to you, talk to the patient and address the concern. So an 8-month-old who is being irritable, and the father has made an appointment to talk to you, and your task is to talk to the father and address the concerns. The background information: the child is 8 months old. For the past 2 weeks, he has not been himself or herself, seems irritable and clingy. The child is irritable and clingy. His wife started work 2 weeks ago. Okay, so at the moment, the wife is at work and he's the one with the child. The wife found a job as a secretary. Other background information: from the beginning, the father will tell you the child is not herself, she is irritable all the time. And I've noticed that the child is very clingy. Okay, child is very clingy, doctor. Questions: what is wrong with my child? What are you going to do? Or do I need to do anything? So approach to this particular task: grips as usual. Then you're going to take the history of irritability. How long has the child been irritable? Does it happen in any particular situation? Is it a whole day or on and off? Or is it constant or on and off? Has it happened before? Is there anything the father feels or the mother feels could be the cause of this irritability? Ideas to the problem is crucial. Then you think about the differential diagnosis: why the child could be irritable, why could it be clingy? Interoception: the child will be irritable, but they will be pulling of the legs towards the tummy. Then ask about the blood in the stools. Okay, ask about diarrhea. Separation anxiety: in this particular case, is the father is looking after the child, the mother is not around. So asking about who is the usual carer, who normally looks after the child is the mother. The fact the mother is away and now the child is there, then that could be separation anxiety. And you need to be asking to say, does this usually happen when the mother is away? Or it is just random, it's not associated with the mother being away. The baby teething: yes, usually the baby will be chewing their finger, sometimes will be biting a finger. So asking, have you noticed if the baby is biting the finger? Drooling of saliva. So things suggesting. Or you can ask directly, is the baby teething? Okay. Tantrums. Okay. Tantrums as well, children throwing things, hitting things, throwing themselves on the ground. So the behavior here will tell us. Then the child could be irritable because of other problems. Ask about the 6 infections: otitis media, pneumonia, UTI, meningitis, upper tract infection, gastroenteritis. Ask about the baby nappy rash. Anything that will irritate them, make them irritable. Okay, good. Now let's look at the symptoms of separation anxiety. The baby being clingy is one of the symptoms of separation anxiety. Baby can be irritable. Baby being clingy and crying. Okay, when their carer, so here I'm going to write so that you can see, you guys, hope you can see, when their carer or their parent leaves them, the main carer, when leaves them, then they become clingy and they start crying. Separation anxiety usually develops between 3 months and 3 years. You see the period 3 months to 3 years is typical. This particular child is 8 months, so it's within the age. It is normal part of development. It's not something abnormal. Okay, good. Then we need to look at the symptoms of the baby teething. Most babies start teething at 6 months. This particular child in this particular scenario is 7 months or 8 months. Again, fits the age. But teething symptoms include baby not being comfortable. Their gum is sore and red. So you can ask the parent, have they looked in the mouth? Does their gums look sore and red? Then they may be running mild temperature. So if the child is feverish, but usually less than 38 degrees. So it's a very mild temperature. One flushed cheek, asking about, is the face flushed? Is there any rash on the face? That also points towards the baby teething. Dribbling, okay, saliva, dribbling of saliva. So let me write in here. Before somebody says it's urinary dribbling. Okay, so it's saliva dribbling more than usual. Actually drooling in here for me, okay? Why dribbling? Drooling is a better word, drooling. Okay, so let's change it to make it clear. Drooling of saliva. More than usual, yeah? Okay. More than usual, okay? Have you noticed that the child is drooling saliva more than usual? Okay, is the child not sleeping well? So the child is not sleeping well because it's teething, because it is pain. He's drooling saliva. There is a rash on the face, or the cheek looks flushed. He has got, is a little bit feverish. Ask if they measure the temperature, the gum, they look sore, and sometimes the child is trying to bite the finger, okay, or to chew the finger. Now, what about temper tantrums? What are the symptoms? Usually starts at 18 months. Now, if you look in here, the age is much older for temper tantrums. It's not 7 months or 8 months like in the other 2 scenarios. It's very common in toddlers. Okay. Usually they will be hitting things, hitting the parents, or biting somebody, throwing themselves on the ground. So that is tantrums. Toddlers, usually a child, wants to express themselves, but they find it difficult to express themselves. And because they can't express themselves, they get frustrated. That's why they end up with this behavior. He gets frustrated, he would cry, he would start biting, start hitting, other stuff. By the 4 years of age, tantrums are usually less, and usually they will resolve. Okay, so those are the many differential diagnoses. One more time: child is irritable, child is clingy, that is intussusception, separation anxiety, baby teething, tantrums, infections, baby rash. In particular, in here, clinching is common in separation anxiety. Okay, and we have discussed the symptoms of separation anxiety, and then there's baby teething to consider as well. There's temper tantrums, but the age here is a little bit different, 18 years or more. Okay, then complete the rest of the history. The P. maftosa, the ice. Child eating and drinking well, up to date or immunization. Make sure child is not dehydrated. Are they happy with the development? Dehydration is one of those things you always have to rule out. Okay? You have to rule out it always. Now, this particular child has got separation anxiety. So what suggests separation anxiety? If we are going to go back to this particular scenario, let's go back to the patient information. It's an 8 months old. It fits the separation anxiety age. Past 2 weeks, the mother is starting new job. The mother is not around. The mother is at work. The child is with the father, and the child is irritable and clingy. And if you ask if there is any soreness or redness in the mouth or in the gums, they will tell you no, there is nothing like that. So the diagnosis in this particular case is what? Separation anxiety. It occurs when the child is away from the carer. In this particular case, the mother. In this case, it's the mother. Because the mother is away, this is why the child is what? Behaving like that, being clingy. It is a sign, actually, that your baby now realizes how dependent they are, not development, how dependent they are on the what? On their carer. Dependent. They are now dependent on their mother, okay? So he's now realizing that. And they are dependent. Second, let's correct this. How dependent they are on the people who care for them. Yeah, how dependent they are. They are starting to realize. That's why they are crying, they are clinching when that person who looks after them is away. It occurs when people closely involved in their care are away. Okay, in their care are away, and they would usually be clingy and cry. So this is what to explain to a parent when this thing is happening. So how do you manage it? What are the tips? So the usual carer before he leaves, if it's the mother before she leaves, if it's the father before she leaves, if it's any other carer before they leave, it's better leaving something comfortable before you leave. What does it mean? Give a child a toy, something the child loves, something comforting before you leave. Smile and say goodbye to the child confidently, okay, and positively. And tell the child you will be back. And tell the child what you'll be doing later. When I come back, we're going to do this, we're going to play this, we're going to eat this. So telling them what you do when they're back. Tell the child or the dad or the grandma is here. So this person is here, your dad's going to be here, he's going to be with you, look at the dad, look at this. So you encourage them. So these are the tips before the carer, the mother, or whoever the first carer leaves. For those that stay with the child, while the child is being clingy, they just have to reassure the child that the mother is coming or the dad is coming. You tell the child, that you are there, I'm here, I'm with you, and you try to play with the child as well at the same time. So you give the child as well a favorite toy or something comforting for the child to have. Okay, so they are the tips only to keep. It is part of the normal development. Nothing needs to be done, just need to reassure. Thank you.